Hi, Weston. Thanks so much for coming into the office today. I'm Emily Turnwald. I'll be your clinician, the one taking care of you.
Okay.
So first we're going to start out with the practice management binder and the 5 tabs that we have in here. So starting with the pre-visit, you'll complete all the paperwork with the CA out front and all of your information that we need from you. So we can skip over that step. And then for visit 1, what we're going to do is we're going to perform some patient exams on you. And what we're looking for with, as chiropractors, we focus on the spine and the function of nerves. So what we're looking for is called a subluxation, which is just a small misalignment of a vertebra. So in your back, you have all these bones called vertebrae, and if my 2 hands are 2 bones, they're supposed to have normal range of motion in them. You have nerves that pass really close to these joints in your spine, and sometimes if those bones get stuck out of alignment, that can put pressure on nerves, which is going to change their function. Okay. So what we're looking for when we assess you is we're essentially looking for that misalignment and it's stuck. So there are 5 parts to this vertebral subluxation complex. It's vertebral because all of these bones in your spine are called vertebrae. It's a subluxation because it's just a small misalignment. That's what subluxation means. It's not like it's dislocated or anything. It's not that severe, but it just means it's stuck out of place. So there are 5 parts to the vertebral subluxation complex, and this is kind of going into what we cover in the healthcare class. But there are 5 components to it. The first is spinokinesiology, which is ultimately just how your spine moves. There's myopathophysiology, which is going to be changes in the muscle. So you could have a really tight muscle, which means that the nerve that connects to that muscle is firing at too high of a frequency, or you could have really muscles with a decreased tone, meaning that they're not getting enough neural input to them. Also, we're going to look for pathophysiology, which could indicate a disease or some organic cause of your symptoms. We're going to look for histopathology, which would be tissue changes, edema, or buildup of fluid, or bone spurs, which could just be buildups of calcium on your bones. Finally, we're going to look at neuropathophysiology, in which we're just scanning along your spine, looking for changes in temperature that we will assess for graphing or pattern. Okay. So those are the 5 components of the vertebral subluxation complex, which is what we're looking for as chiropractors. So on your first visit, we're going to start conducting some of these exams. There are 3 categories to these exams. The first is the physical exam, which would include orthopedic tests, sensory and somatomotor exams. And when we're testing for these things, we're just looking to see that there's not an organic cause or a disease pattern that's causing your symptoms. Next, we're going to look for the chiropractic exams. And in these, we're looking for that vertebral subluxation complex, which would include the spinokinesiology and that list of 5 things that we're looking for with the subluxation. And then finally, we're going to take some x-rays of your spine to look to see if there's any lipping or spurring in there and to see exactly which segments are out of alignment. So once we do all that, we will go to your report of findings. Okay. So we'll start with the clinical findings and what we found with your specific case. So we'll go into the spinal kinesiopathology. And with this, we're just going to be feeling your spine as it moves, which is called motion palpation. We're looking for anything that's not moving properly. And then we're also looking for compensations. So is your body compensating at different points for the fact that certain segments aren't moving properly? And then we're also going to assess your ranges of motion. So how far you can tuck your chin to your chest and extend it. Also with rotation, like looking over your shoulder, and then lateral flexion, touching your ear to your shoulder on either side. Next, we're going to look at the neuropathophysiology, or looking at how your nerves are functioning. This is a really great diagram of how a damaged nerve is not functioning the same as a healthy nerve. We're also looking for myopathology, which I was talking about, that muscle spasm, that muscle weakness. And what we really want to see is both sides, the muscles, are functioning properly. So we like to see that symmetry. Next, we're going to look at histopathology, which we can see on the x-rays here. And then as it progresses, you can see phase 1 looks pretty normal, but as we get up to phase 3, we see a lot of that lipping and spurring on the vertebrae here. They're not nice and square anymore, and they've got some indents and bumps on them. Next, we're going to look at the spinopathophysiology, which would be the x-rays. And you can see here, starting with these x-rays of the neck or cervical x-rays, near normal, we have this gentle C curve, which is really good to see, and the vertebral bodies have a nice square symmetrical appearance to them. Next, we have phase 1, where we lose that nice gentle C curve, and it's a really straight neck. It's what we call military neck. Phase 2, what we have is we start getting some of that lipping and spurring on the vertebral bodies, and we get kind of a reverse curve going, and that C curve is going in the opposite direction now. With phase 3, we start losing the space between the vertebrae, which is the intervertebral disc space, so those discs are flattening out, and we get even more lipping and spurring here. And then phase 4, what we have is eventually those discs will get so flat that they essentially disappear, and we start getting fusion of those vertebrae so that they're not moving at all now. The good news is anything up to phase 3, we can start to reverse that progression. And it's possible to just reverse that, but once we get up to phase 4, there's really nothing that we can do about that. So we like to act early. So also what I want to go over with you is just some of our office policies. So for the office, we just request that you give us at least 24 hours notice if you can't make your appointment, but you also get a free pass because we understand that family emergencies come up and sometimes you just can't make it. But we just ask that you make a commitment to us that you're going to be there because we're making a commitment to you to give you the best care possible. So we just ask for that commitment in return. And then for the financial part of things, you can pay for your appointment just after each individual appointment, or you can pay for the entire month in advance. Next, we will, or after we finish your initial treatment of your symptoms that you have now, so we'll start out with 3 visits a week for 4 weeks, and then once we end that 4-week period, we'll reassess everything to see what kind of progress you're making. So then we'll conduct a progressive exam, and once we're done with that, you can make the decision of whether you'd like to continue care with us or if you would like to discontinue care. If you want to continue care, there are 2 options that you can make. The first one is subluxation condition-based care. So with that one, you basically call as needed and make an appointment whenever you feel those symptoms coming on again. The second option is wellness development care, in which you have regular appointments with us so that we prevent those symptoms from coming back. And so with the benefit to wellness development care is we keep getting you closer and closer to your ideal level of wellness, whereas the subluxation condition-based care is really just keeping you from getting any worse. So once we finish your initial treatments and hopefully relieve you of some of those symptoms, then we can make that decision in the future. What I would really recommend is that you come to one of our healthcare classes. And with these healthcare classes, they're every Wednesday night for an hour. There are free refreshments. And then during these talks, I'll go into a little bit more detail about that vertebral subluxation complex we were talking about earlier. And we'll provide you with 3 extra tickets for it so that you can bring some friends and family, because we have found that the patients who have a strong support from their friends and family tend to stay committed to care a little bit longer and they see the best results. So at the healthcare talk, I'll just be talking more about that vertebral subluxation complex and how it can affect our body and our physiology. And then at the end, I'll be free for any questions that you have for me, and we'll give you the fire drill rundown of what it would take to sign up for care. If you're interested in any research involving chiropractic, we have this lovely binder, and in it we have some articles about the vertebral subluxation, And there's a lot of case studies of people who have reduced blood pressure from receiving chiropractic care. They're relieved of their headaches. Then we have wellness development care. And we have a lot of people being relieved of symptoms with this, such as asthma, also reduced blood pressure for hypertensive patients. And then we have the condition-based care. And so here we have like a gastroesophageal reflux disorder in an infant that was relieved. And then a 10-year-old patient was relieved of pain after only a few months of receiving care. And the list goes on and on. So we have chiropractic spinal, and in this we have an article talking about the cost effectiveness of manual therapies and how chiropractic care is actually more fiscally ideal than going to a medical doctor just to manage the symptoms. And then this also talks about the risk of stroke after a chiropractic adjustment, and we kind of have a bad reputation of some people are scared that we're going to induce a stroke, but this study indicates that there's a small difference between the risk of patients who saw a chiropractor and those who saw an MD. So there's really no risk, essentially, with receiving a chiropractic adjustment. We also have the functional neurology in chiropractic, and so we have a child with autism who had improvement in their symptoms. Here we have a 6-year-old child with ADHD. And then the list goes on and on. So there's a Parkinson's patient. Here we have the current mechanical systems for chiropractic, some of the different techniques that we can use. Here's just a list of some of the techniques. And then we have an article that talks about how using different techniques for different patients could be ideal based on some of the details of each patient. Here we have some articles about medicine and bad side effects due to medications such as statins can cause muscle pain, and then some children with adverse reactions to medications. And then we have the vitalistic system, which essentially is at the root of chiropractic. This article talks about the wholeness of the person in health and disease, and that's how we see the human body. Even when you're sick, it just means that your body is functioning the way it's supposed to because it's fighting something off that is going to interfere with your ability to adapt. So in chiropractic, what we aim to do is to relieve that vertebral subluxation that's going to interfere with that message of the nerve between your brain and your body so that your body can function more optimally. So do you have any questions for me?
Nope.
Okay, thank you so much for your time.